There's evidence of arthritis.
When you look at x-rays of Everett Hamilton's hip,
It stopped me a great deal from doing a lot of things.
you can understand why he's in pain.
On a scale from 1 to 10, it's always about an 8.
This is basically where we would describe this to be bone-on-bone arthritis.
The reason why it hurts all the time is because you can't walk right, and it's all because of the hip.
Everett needs a new hip.
Bye, sweetie. I'll see you later, okay?
He's getting ready for a total joint replacement at Northeast Baptist Hospital.
I'm gonna put this in here real quick. This consent. Oop.
He had one hip replaced 2 years ago and has come back to the same hospital and doctor for what he calls excellent care.
And from there we can go up to about probably 50.
The physician in charge of this life-changing operation is orthopedic surgeon Dr. Brian Schultze. He's been operating at Baptist hospitals for almost 2 decades.
54.
5'4".
In a procedure that takes about an hour, Dr. Schultze removes the worn-out hip joint and implants a new man-made version of metal and hard plastic. It's an exacting task that requires an experienced team.
And so the setup of the operating room, the setup of the position of the patient, a good anesthetic team, good OR team, all these things are very important. Go ahead, Jan, walk down to the end of the hall, and we've been very pleased with our results.
At his office, Dr. Schultze follows up with Jan Keller,
And walk back.
whose joint deteriorated to the point where the 53-year-old needed a new hip.
The socket was a little shallow.
A condition called dysplasia was the seed of her growing pain. The normally active Jan, who hiked trails, walked on the beach, and scaled rocky walls, was forced to use a cane, then a walker.
Even that was difficult and painful and demoralizing.
And rotate that leg.
When he said surgery, I was like, let's do it.
Jan compliments her surgeon as caring and knowledgeable.
He answers questions thoroughly.
That shows pretty normal range of motion.
When I'm talking with him, I feel like he's got all the time in the world for me.
While many patients fear joint replacement, Jan says it has truly given her her life back.
It's such a difference. It's night and day.
We don't make any promises, but some of these joints are lasting 15 to 20 years and sometimes even longer. We've been able to give people really good outcomes. If you do very well, you'll wish you had done the joint replacement sooner.
Expert joint replacements with irreplaceable care. That's the difference. That's Baptist Care. For more information, log on to bhsjoints.com or to connect with Baptist, call 210-229-2289. For the Baptist Health News Network, I'm Wendy Rigby.